Welcome, everyone. Thank you for attending the town hall. My name is Renee Perkins Johnson. I am your District 4 City Council representative, and we are excited today to present this information. I've gathered some hosts. I'm hosting and gathered some experts, subject matter experts from the community on this important subject. But before we get started with introductions, I'm excited to share a video with you. So if we can roll the video, you have a spot, take your shot.
I want all of the people who are my age to enjoy their golden years.
I mean, it just makes good sense to try to protect yourself.
I've got great-grandchildren out there I haven't seen, and I'm looking forward to that.
I'm asking my seniors and my young people to encourage my seniors and my young people to participate in this process.
What you do to keep yourself healthy helps keep your neighbor, your friends, your relatives, helps keep them healthy too.
I'm excited, relieved, and grateful. And taking the shot is what's best for all.
I encourage all of us to say, I'm not through. There are things I still have left to do, and I'm going to fight this head on. I'm going to get vaccinated.
I feel very much that this allows me to be more in control of my life, less fearful. Doesn't mean I won't wear a mask, I will.
If we take it seriously, we can be past the horrors of 2020.
If you have a spot, take your shot.
You have a spot,
take your shot.
You have a special spot, so please take your shot.
You have a spot.
Take your shot.
Thank you so much. So the purpose of today's town hall is to educate the public on the COVID vaccination, the process, the statistics, the rumors. We want to dispel some myths out there, and we want to share the information to dispel the myths and also to give you information so that you all can make informed decisions for the vaccination. I have today, I'm sorry, the first guest was going to be County Commissioner George Dunlap, but he is having some technical issues. I also have from the North Carolina Department of Health and Human Services, Hattie Gawande. From Mecklenburg County Health Department, there's Gibby Harris. And I have doctors from Atrium and Novant, Dr. Catherine Passerati, and from Novant, Dr. Augustus Parker. So without further ado, I'm going to turn it over to Hattie Gawande from North Carolina Human Services. Thank you.
Excellent. Thank you so much. Thank you so much for having this awesome panel on. Really glad to be able to provide information about the vaccine today, and basically kind of both go through a quick kind of Vaccine 101 and then go through a few of the operational details that I know a lot of people are wondering about. So I'm going to try and speed through this so that I can get you over to Gibby in a second, but let's just dive right in. And of course, before I start, I always like to say that for the majority of North Carolinians, it's going to be a while until you can get your vaccine. You have a spot to take your shot, but it might take a little while to get there. So you should be taking these preventative measures in the meantime to keep yourself safe so you can get there. I'm just going to dive in and talk a little bit about the high-level points that you need to know about the vaccine, including that it is free to everyone, but vaccine supplies are currently limited, so you will likely have to wait. Before I dive in, I always like to start with a statement on equity. Way back many months ago when we started thinking about our vaccine distribution plan, the first thing that we knew we had to acknowledge is that racism runs through all of our systems, which in particular cause unequal access to care healthcare, and we knew would cause unequal access to vaccines. Plus, these longstanding and continuing racial and ethnic injustices contribute to an understandable lack of trust in vaccines. So we knew we would have to overcome both of those barriers when we were building our vaccine distribution plan. And the way we did that was by making sure that there was representation from historically marginalized communities, not only advising our vaccine distribution plan, but at the decision-making table, making the decisions alongside us. So I think you'll see that running through this distribution plan. So at a high level, these are kind of the 5 messages that you need to know about the COVID-19 vaccine. And I have an ulterior motive here. My goal is not only to get you the information that you need, but recruit you into the core of vaccine experts who can educate your communities and your neighbors, if you're an employer, your employees and your friends, about why they need to be getting the COVID-19 vaccine. And these are the messages that you can relay to them. The top line is that tested, safe, and effective COVID-19 vaccines will help us get back in control of our lives and back to the people and places we love. But on top of that, people need to know, number one, that scientists had a head start and thousands of volunteers helped with the clinical trials. I'll dive in a little bit to what that means in a minute, but I think a lot of people are hearing that this is a new kind of vaccine, and they've observed that it was developed in less than a year. But I think what people also need to know is that the science underpinning the vaccine has existed for decades, and it's nothing new to the researchers, although it is a remarkable technology that's being deployed for the first time in a federally approved vaccine. Number 2 is that the vaccines are tested, safe, and effective. I'll get into the testing in a minute a little bit. Number 3 is you cannot get COVID-19 from the vaccine. That's really important. There's no live virus in the vaccine, unlike other vaccines you may be used to. So you will not be getting sick from COVID-19 if you go and get the vaccine. Number 4, I think I've already said this twice, and you'll hear me say it several times again. Supplies are very limited right now. So you won't be able, the majority of people are not able to go out and get a vaccine tomorrow. And that's because we just don't have enough doses in the state for every one of our 10 million residents to get it. So expect that you will have to wait, but you do have a spot to take your shot. So as I said, scientists had a head start. I'm not going to linger on this one, except to say that there are North Carolina scientists, including Dr. Corbett in the picture there, who worked on the technology used underpinning the vaccine. So it's very familiar to our scientific community. The vaccines are tested, safe, and effective. So as I mentioned, thousands of people, more than 70,000 people volunteered in the clinical trials for 2 vaccines. That's the Pfizer vaccine and the Moderna vaccine. None of those trials resulted in serious safety concerns. At the same time, when you get your vaccination, you should expect that you will feel some temporary reactions like a sore arm or a headache or feeling tired and achy for a day or 2. Quick personal anecdote, my 83-year-old grandmother and my dad participated in the clinical trials for the Moderna vaccine, and they think that they got the vaccine because they both had low-grade fevers for a day, but they're both doctors, and they told me that that means that the vaccine is working. That is your immune system getting ready to fight the virus if it ever actually comes to town and visits you. And then last thing is the vaccines are shown in those clinical trials to be 95% effective in preventing COVID-19. For those of you who know about the efficacy of the flu vaccine, for example, a 95% efficacy rate is huge. A little bit of a deeper dive on the clinical trials. We know in medicine and we know in pharmaceuticals that often these kinds of trials don't do a great job representing diverse populations and the populations that are going to ultimately be taking the vaccine. In this case, Pfizer and Moderna made intentional efforts to recruit volunteers from historically marginalized populations so that we can say with confidence that they work for most everyone. This is, I'm going to go real quickly through this, but Like I said, you can't get COVID-19 from the vaccine because there's no live virus in the vaccine. Instead, what the vaccines do is they imitate COVID without actually giving it to you. They teach your body to make a protein that safely teaches your body to make an antibody to fight the real COVID-19. And those antibodies are what will be able to fight off the real virus if it actually tries to attack you. Many of you have heard that, at least with the 2 vaccines that we have so far, you need 2 shots to reach full immunity. The second shot will come 3 weeks after the first in the case of Pfizer, 4 weeks after the first in the case of Moderna. I've heard a lot of anxiety about people saying, well, how am I going to know to get my second shot? Is there going to be enough supply? Are there supply chain issues? And I will say, number one, we built a system, the COVID-19 vaccine management system, to help providers make sure everyone gets the right second dose at the right time. When you go to get your first shot, either you will be able to schedule your appointment concurrently, or you'll get a little appointment card for your second shot. So everybody is making sure that you will get your second dose on time. The second doses are shipped separately, and so far we have gotten the exact same second doses corresponding to the first doses that were sent a few weeks earlier. So we have no concerns about supply. And then I'm just going to keep speeding along so we can get to Gibby, but a number of North Carolinians and prominent North Carolinians have gotten their vaccine. You saw Governor Jim Hunt on the prior slide, and in the video, this is Representative Shelley Willingham sharing why he got the vaccine. I get a lot of questions about privacy and personal information, so rest assured that those are protected at all times. Number one, you might have heard this in corners of the internet about tracking. Nothing in the vaccine can be tracked. The protein that I mentioned that your body makes, it gets broken down and it gets flushed out of the body like every other protein after it finishes teaching your immune system to make antibodies. So nothing in the vaccine is trackable. Your personal information is protected if it's collected. When it's collected, when you go and get your shot, we don't send it to the federal government. We don't send it to the CDC. It's stored in a HIPAA compliant vaccine management system. So rest assured that we take that very seriously. So I'm going to pause here for just a second to really hit home this point about supply. I said before, I think I've said it maybe 4 times now. This is really where I'm going to hit it home. We only get about 120,000 to 140,000 vaccines in North Carolina each week, which for a state of 10 million people is not very many. And certainly a fraction of the share of the vaccinatable population. So as a result, you're going to have to wait to get a vaccine for the most part. We are vaccinating people in phases or in groups so that those who are at the highest risk for COVID-19 and the highest risk of severe illness from COVID-19 can get it first. But we expect there to be, for the most part, wait times, although everyone will have their chance when vaccine supplies increase. The only thing I will say here is just reinforcing the point that vaccines are available for free. The federal government is paying for the cost of the vaccine, so nobody should have to pay anything out of pocket. Some providers are charging an administration fee. They'll charge insurance for that. And if you don't have insurance, we have a separate pool of funding for that. So nobody, whether they have insurance, whether they don't have insurance, should be paying anything for the vaccine. So this is the prioritization strategy that I mentioned a moment ago. Because vaccine supplies are so limited, we really want to get the first vaccines to those who are at the highest risk of getting COVID-19 or of suffering severe illness from COVID-19. Right now, healthcare workers, long-term care staff and residents, and adults 65 and older are eligible to get their vaccine. And many of our folks 65 and older, and even in some places, some healthcare workers are on waiting lists, and they'll get notified when appointments open. Some time from now, we will move on to vaccinating frontline essential workers. And then we will vaccinate adults who have underlying conditions and additional essential workers. And then in the last group, everybody will be able to get a vaccine who wants it. So like I said, healthcare workers, long-term care staff and residents, and adults over 65 are being vaccinated right now. Only a few vaccine providers are currently approved to be receiving be receiving vaccine directly. And for the most part, that's local health departments. And Gibby, I'm sure we'll talk a lot more about that. That's hospitals. In some limited circumstances, that's federally qualified health centers and other community health centers. And then slowly we're bringing on board additional providers. But remember, as long as vaccine supply is limited, bringing on board more providers means that we're going to be taking it away from existing providers. So a lot of people are saying, well, when is my pharmacy going to get vaccine? When is CVS and Walgreens going to be giving me vaccine? And so the answer is that things like that will be coming when we have more supply. Just going to demystify for a second what the COVID supply, the sort of shipping process looks like, because we get a lot of questions about, well, you know, can't you stop the vaccine from going to this community and sort of redirect it? And we at the state don't have vaccine pass through our hands ever. What happens is every week around Tuesday or Wednesday, the federal government gives us a number and they say, this is how many vaccines you're going to be getting next week. We take that number and we determine which providers will receive how much vaccine based on whether they can reach the prioritized groups. Then we put an order in with the manufacturer and they ship the vaccines directly to local providers. So once again, it doesn't stop in our hands. And then the providers safely store and handle the vaccines and North Carolinians get their vaccines in groups. So how can you find your spot if you're eligible to get your shot? I think for the majority of folks who are healthcare workers or long-term care staff and residents, you should have heard from your employer or from your facility about when you can get your shot already. But for those who are 65 and older, you are able to schedule appointments through approved vaccine providers. And there are a couple of hubs where you can find those providers. I'm actually going to go into that more on the next page. So one is yourspot.yourshot.nc.gov is a fantastic repository of information, which includes all the providers in your area. And by the way, we have a Spanish language version of that website as well. There is also, for those who may not have internet access or may not be as comfortable navigating the internet, there is a COVID-19 vaccine help center with at that phone number, which contains all the same information, but you can get it from an actual human being. And again, there's an option for Spanish at that line. And then we have two new tools that I'll just show you on the next page. The first is Find My Vaccine Group. So if you're confused about where you fit in the scheme, you can go to Find My Vaccine Group you just sort of put in your age, you can click a few buttons to indicate what your profession is, and you can find out where your group is. And then find a vaccine location, you can find local providers near you based on your zip code. And this kind of just hits home the point that leading medical and professional organizations agree the vaccine is important for us to take and safe for us to take. And then I will just end here by saying that all of these resources, including the deck I just went through, PSA videos from trusted messengers, frequently asked questions, which are updated regularly, are available on our website, yourspot.nc.gov. And I will close it off there.
Thank you so much, Patty. That information was wonderful. Thank you. We will take questions at the end, but Hattie, if you're able to type in those websites and telephone number in the chat, we'll make sure we share those on our website.
Will do.
Thank you. Next, I'm going to turn it over to Gibby Harris from the Mecklenburg County Health Department. Thank you.
Thank you, and good evening, everyone. I appreciate the opportunity to be here and to share some basic information. I'm sort of going to build on what Hattie was talking about and give you a snapshot of what's going on in Mecklenburg County and what you can expect to some extent moving forward, as much as we can project. So just a couple of quick slides to give you an idea of what we've been seeing since March. It has been almost a year since this started in Mecklenburg County. That's hard to believe sometimes, but as you can see, we did have a significant spike in January in our number of cases. We've had a steady increase since October. Our numbers are starting to come down a little bit. These are our daily case counts. We're averaging about 610 cases a day, which is an improvement over where we had been a couple of weeks ago. So we're hoping for that trend to continue. Next slide. This shows you our positivity rate, which is the number of individuals who test positive per the number of tests that are being done. And again, you see the number that went up in December and January is slowly coming back down. And that is about 10.7% average at this point, which is down. We had gotten up into the 15, 16% range. Unfortunately, at one point in October, we were down to 5%. So we're still high, but trending in the right direction. Next slide, please. And this shows you our hospitalizations, our daily census count for our hospitals. We're averaging about 372 people in the hospital per day right now. And you can see there's been a fairly significant decline over the last couple of days. But I do want to point out that it's still the highest it's been since the beginning of the pandemic. Next slide. And this is the one metric that is of concern to me. We follow the outbreaks in our congregate living settings. And as you can see, that number has continued to trend up for us. Just this past week, we had the largest outbreak we've had since the beginning of the pandemic in one of our homeless shelters. We had over 100 cases in that one shelter. And our long-term care facilities continue to see, we're seeing long-term care facilities with their second and their third outbreaks. So we know that we continue to have a lot of virus in our community that very easily spreads to our most vulnerable populations. So we have to stay vigilant around those sorts of things. Next slide, please. So the one point I did want to make about testing, we have seen a little bit of a decline in the interest in testing, but testing is still important. We want to make sure that people who have been exposed or potentially exposed to someone who's positive, or individuals who participate in gatherings of any kind, that they continue to get tested. We still know that we have a large number of folks who are asymptomatic, but are shedding virus in our community, and that helps it spread. So if you fall into either of those categories, we really want you to be tested. But I also want to point out that we're starting to see some pop-ups in different places around our community where people are charging for a COVID test. There is no need for anyone to pay anything out of pocket for a COVID test in our community. We have sufficient testing available in our community. Two examples are drive-through testing Monday through Friday from 10 to 4 at the Northwest Health Department on Beatties Ford Road and at the Bojangles Coliseum Auditorium on Independence Boulevard. You can go to the starmed.care site to pre-register. That's easy to do. And the good news is that our average turnaround time on testings these days is less than 2 days. So want to encourage people who need testing to continue to access that. Next slide. So vaccine is the hot topic these days, obviously. And as Patty mentioned, Group 1 and Group 2 are the ones that we're focused on right now in Mecklenburg County, as well as the rest of the state. We have a working group that includes both of our healthcare systems, emergency management, medic, and some of our other community partners that are continuing to do planning and developing a coordinated approach around communication, outreach, and delivery in Mecklenburg County. And that work continues on a weekly basis. Next slide. So just for the health department, this is health department data only. We've received a total of 11,525 doses to date since the beginning, when we got our first doses the week of Christmas. And we have given 13,274 doses. These are first doses. You wonder how that happens. The vials come supposedly with 5 doses in them. Many of them were able to get an additional dose out, and that's how we've been able to give those additional doses. You can see the number for our second doses as well. What I can tell you is that we're getting those doses out in the week that we get them. As soon as we get them, they're going into arms, they're out the door. Most of our vaccinations are happening at the Bojangles Coliseum. That's Monday through Saturday, 8:30 to 4 by appointment. People can go to our mecnc.gov/COVID-19 website or they can call us at 980-314-9400, option 3, to make an appointment, and I'll put that information in the chat box here in just a minute. We don't have as many appointments as we'd like to have. We don't have as many appointments as the demand is there, and neither do either of our healthcare systems. As Hattie mentioned several times, our allotment of vaccine is limited. So we will continue to make those appointments available as they come up. Next slide. So we are beginning to be able to pull more data around the vaccine administration to really look at who's being vaccinated, and this is driving some of our efforts moving forward. As you can see, out of the 13,274 doses, 69, almost 70% of those have gone to white non-Hispanics, 16% to Black non-Hispanic, and 5% to Hispanic, 5% to Asian. Next slide. If you break that down into the two groups, our healthcare workers, you can see the breakdown there, and I'll make the point that our people of color are underrepresented among healthcare workers. The majority of them happen to be white, many of them happen to be female, and so this slide is not unusual, but we still want to make sure that our people of color that work in this area have the option of being vaccinated. Next slide, please. And this shows in our 65 and up. The blue line shows the percent of the 65 and up population for that demographic, and the orange line shows how many have received their first dose. As you can see, we are underrepresented in our Black community, underrepresented in Hispanic community as well. This is a particular concern to us, and we're continuing to work on that, and I'll talk about that in a second. Next slide, please. And this just shows a slide of the distribution of where the individuals live that have accessed the vaccine. These are for 65 and older by zip code, and obviously we have work to do there as well. Next slide. This particular map shows you the locations of sites where we have been getting out into the community to give vaccine, to try to increase that equity that we're talking about, making sure that people who need the vaccine are able to access it. Some of these are sites that have been completed already. Some of these are upcoming sites. These include sites for Atrium Health and Novant Health, as well as the health department, and we're continuing to expand that. In addition to that, the health department has also been to 15 long-term care facilities in our community who did not sign up for the federal program, so we're trying to make sure that that population gets vaccinated as well. Next slide. So one thing I did want to mention is we have developed an equity plan that we're working. We want to assure that vaccine is equitable to those populations in our community who are most disproportionately affected. And in our community, that is our Hispanic community and our Black community. We are seeing more of the deaths in our Black community for those who are dying in the community. And our Hispanics are disproportionately affected as well. That particular plan looks at a lot of effort on education and building trust in those communities, working with key partners and leaders in our community to carry those messages. We're working to improve our vaccine appointments, making sure that they're low barrier, that people can access them. So again, telephones as well as online appointments. We're doing targeted vaccine distribution. That map was an example of that, and also looking at the data and monitoring that on an ongoing basis. The last thing I'll mention is we do have material. The state sites are great. We have a lot of information on our county website as well. We're also looking to co-brand things. These are two examples of that with Atrium and Novant. So one is a specific information about the vaccine. The other gives examples to people about how you can schedule appointments. So please make use of our website as well. And we're making those materials available in multiple languages, English and Spanish, but we have a large immigrant and refugee community here in Mecklenburg County. So we're attempting to make sure that that's available to them as well. And next slide. I want to emphasize, I want to caution everybody. The vaccine's wonderful. We're so glad to have it. As Hattie said, we don't have enough to go around right now. And even if we have it, you still need to wear your mask and socially distance and wash your hands. And I can't stress enough to avoid gathering in groups. We've got a big weekend coming up with the Super Bowl, and that is usually a time for people to get together and have large parties in homes and to be out in bars and restaurants. Please, right now, our numbers are going in the right direction. We need our communities to stay home and enjoy the Super Bowl with the folks that they live with. And so I'll stop at this point. Thank you for the opportunity to present.
Thank you so much, Gibby, for that important information. Commissioner George Dunlap has joined us. If you'd like to say a couple words or a few words, Commissioner.
Well, thank you so much for all the trouble we had to go through to get me linked in, but I am certainly delighted to be a part of this. I think I also want to thank you for inviting me because oftentimes people don't get the opportunity to know that their city council representatives and their county commissioner representatives who represent the same constituency are working together. So this is a great opportunity for them to see that happen. So I want to thank you for that. And I want to thank Gibby. Gibby does an outstanding job. And this presentation tonight is no different than the presentations that she has done in the past. A lot of people don't know the sacrifices she makes to be a part of our community even. And so Gibby, let me again thank you for all you do to make Mecklenburg County safe. I do want to take this opportunity to say a couple of things relative to what is being said. One of the things that we're having difficulty finding out is just to the degree that the vaccine is being dispensed within the community. What Gibby was able to give you was what Mecklenburg County does. But we also have these other groups like Novant and Atrium and then CVS that are also doing vaccines. And we're not able to get those numbers yet to tell you just how much vaccine is being dispersed in the community. So it's much bigger or much broader than what Gibby was able to report. But I think people need to know because there are other sources other than Mecklenburg County Health Department that you can use to have the vaccine. One other point I want to make is that as these pop-up vaccine sites show up, and I know we're having one at my church on Thursday, there are people who will come to these sites who already have appointments. And I can't stress enough how important it is that you let people know that you want to cancel the appointment that you already have because it's taking up a time slot. There's a vaccine dose waiting for these people, and then they don't show up because they've already gone somewhere else and gotten the vaccine. So I can't stress enough how important it is for them to do that because it allows us to at least have other people who are waiting to go and get vaccinated.
Thank you so much, Commissioner. One of the things that Gibby mentioned was co-branding. And so that's why I invited Novant and Atrium because we know that there are residents that might be connected with Novant or might be connected with Atrium. So this town hall is about getting the information out in collaboration with the county commissioner. And that's what we're here. We're here to inform the community and leave some time for questions. We want to answer some questions. We've seen a lot on television about the vaccine, but I haven't seen a whole lot of opportunities for people to be able to ask questions. So we'll move along so that we can get to those questions and answers. Next on the agenda, I have Dr. Katie Passerati from Atrium. Thank you, Doctor.
Thank you so much for allowing me to be on this panel with these other amazing speakers. I'm just in the way of background, I'm an infectious disease doctor that works for Atrium Health. So I see patients in the hospital with a variety of infections, and I've also been deeply kind of embedded in the pandemic response for Atrium. So my information is a little bit more on the sciencey side of things. I'll try to keep it high level and hit the questions I'm getting as an infectious disease specialist, and not kind of repeat things that have been said previously. Do you have my slides by any chance?
Yes, they're loading.
Okay, thank you. Well, I'll just start talking, and hopefully the slides will pop up here in a minute. You know, Gibby and Hattie hit on kind of the general trends that we're seeing. I think most importantly on the hospital side is to emphasize the trends that we're seeing as far as hospitalizations and, you know, unfortunately death. So with Thanksgiving, Christmas, New Year's all on top of each other, within the healthcare systems, we've been seeing very, very high number of cases of patients with COVID requiring hospitalization. And unfortunately with that, a large number of deaths. You know, to the point that, you know, our hospitals have been full. We've had to open accessory areas of the hospital. So, you know, I still from time to time hear concerns that COVID isn't real or these numbers are not real cases and whatnot. And I would just say, speaking as a physician, you know, taking care of patients on the front line, this is very real to healthcare. This is, you know, can be very dangerous. The people most at risk are older individuals, but as has been mentioned, it's really important. Yay. Can you forward a slide or two, please? So if you can just hang here for a second. So it's been mentioned a couple of times how important it is to make sure we're reaching communities of color. And this slide is from, you know, national data, but what we also see in our general area. So we know that communities of color not only see more cases, more transmission within their communities, but specifically Black African-American communities see increased deaths. So, you know, the COVID pandemic has further highlighted the issues with racial inequities in healthcare and has highlighted how very important it is to make sure that we're reaching all populations equally and, you know, overcoming barriers to care across all fronts. Next slide, please. And, you know, I put in this slide just so you have kind of a visual of what this virus looks like. And so you know a little bit about the vaccine. So the virus has a protein, a piece sticking out of it that allows it to attach to human cells and infect. And that's called the spike protein. And that is what all our vaccines really target to kind of get our immune system going, as Hattie had said previously. So the immune system, when you're faced with the actual virus, can kind of swoop in, get it under control, and keep you from coming sick. So you may hear about this spike protein. It's very important for how the virus works and in protecting you from infection with the vaccine. Next slide, please. The way these vaccines work in particular is they really just include instructions for your cells to produce that one protein, that spike protein. So again, as has been mentioned, it's not the entire virus. There is zero way that this vaccine can give you COVID infection. It just instructs your cell how to make this one protein that your immune system responds to. And then again, when you're faced with the actual infection, the antibodies and other kind of parts of your protective system swoop in and keep you from getting sick. Next slide, please. And this is for people that like to get in the weeds with data and information, just information about the currently approved vaccine candidates from Pfizer and Moderna. There are a lot of similarities between the vaccines, and you know, just a couple to point out. The first thing is that both vaccines have been shown to be better than we ever thought as far as protection from developing symptoms of COVID infection, so 95%. For comparison, the threshold that's set for a vaccine to be approved is 50% protection.
So this is way better than we ever thought we would get with a vaccine at this point in time. And both the Moderna and Pfizer showed very similar levels of protection across all racial groups, ethnic groups that were studied, and in individuals that were older. So, just important to know that these are very effective at protecting the individual. What the studies did not show, and which is part of the reason that we continue to recommend wearing a mask, we do not know. We know that the vaccine protects the individual vaccinated, but whether it also protects that individual from without symptoms being able to spread to other people, we need some more time to study that. So that, in addition to the fact that it will be a while before we get a lot of our community vaccinated, just reinforce again those 3 W's that we'll all mention, I'm sure, throughout the course of our time. The other thing I just want to hammer home again is the safety of this vaccine. So there were over 70,000 people in these 2 trials, and now millions and millions of people have gotten the vaccine, and it is safe and effective. So, local side effects, pain in the arm, feeling run down, especially after that second dose in people that are 25 to 55. But really the comparison between people who get the fake vaccine in the trials versus the real vaccine, no increased incidence of severe side effects, anything that hangs around for a long time. And the other thing that hasn't been mentioned yet, but I think is a little bit important to know about, these vaccines require 2 doses, as y'all know, but they also have to be kept very, very cold. So that limits how long they can be out and about and limits the number of locations they can be distributed at. And that's part of the reason, as has been mentioned, it's really right now primarily with the health departments, hospital systems to get that vaccine out where you can centralize and make sure they're used before those doses have to go, have to be put back in the freezer. Next slide, please. And because I think a visual is helpful, I think these are both slides from the FDA for Pfizer and Moderna vaccine. And the top line on both sides are people that got the placebo or fake vaccine, the cases of COVID in those individuals. And the bottom line is those individuals that got the vaccine. And you can see that sharp difference between ongoing increase of cases in people that did not get the vaccine and the nice decrease that sustained throughout the course of the study in individuals that did get the vaccine. And the other thing to point out is that the vaccine isn't immediately effective. So certainly after you get 1 dose, it really ideally you get both of those doses. And even after that second dose, it takes about 2 to 3 weeks for that vaccine to kick in and protect you. So it's important for people not to just immediately, once you get the vaccine, go and hang out in a large group or not wear your mask. It's just important to know that it takes a while for your body to start that protective process. Next slide, please. And then I'll skip over the last couple of slides, but I do want to, just because it's been in the news a lot, talk about these newer strains of COVID that we're starting to see in the United States and other parts of the world. So, viruses all change over time. That's how they survive. That's how they keep going. And the COVID virus has been changing over time as well. And up till now, those changes have been minor and not significantly impacted, what happens when you're infected with COVID. But what we're seeing now is the beginning of mutations or changes in the virus that allow it to be more easily spread. So far, no significant data suggesting these new strains cause you to be sicker at the individual level, but obviously more people infected, more easily spread, higher hospitalizations, higher, consequences of that. So I won't go into the details of the different strains. There are some slight differences. What I will say is the best chance of getting control of these strains and making sure that we protect our communities is to get vaccinated, get people vaccinated in a timely manner. That decreasing of the number of infections in our community helps prevent, those strains from developing and protects everyone. And while there may be, that 95% level of protection that I mentioned in the Pfizer and Moderna studies, maybe slightly lower for some of these newer strains that we're seeing. The vaccine still will provide some protection. So, these haven't changed enough based on the data we have right now that it will the vaccine is completely ineffective. But, each amount of time that we're kind of slowing down or not wearing our masks or not getting people actively vaccinated, it allows those strains to kind of spread, change further, and chips away at our protective. So, the development of these strains, I would just encourage people, is not a reason to say, oh, the vaccine's no good, let's not do it. It's a reason to double down and get vaccinated to prevent the development of more of these strains in the future. Next slide, please. And then I'll skip through these so I don't go into the time for the other panelists, and because a lot of these have been hit on by Gibby or Hattie as far as some of the myths and facts about the COVID-19 vaccine. Next slide. And then your 3 W's we'll see time and time again. And then one more. And then, just within Atrium, as far as the scheduling process, I'll put some of this stuff in the chat so they can send it out later. The best way to get scheduled at Atrium is to download My Atrium, and you can do a pre-assessment there to see, find out when your turn at getting vaccinated is. All the healthcare systems in the state follow kind of state guidance as far as who can be vaccinated. So, there really should not be difference between who can get vaccinated in one location or another, but we can kind of let you know when your turn has come up. And then I will say, Gibby mentioned some of the mobile units and whatnot. So it is super, super important to make sure that we're equitable in this vaccine distribution and addressing issues with vaccine hesitancy across all populations. So, there have been mass events the past couple of weeks. There will continue to be walk-in and drive-up locations at the Atrium facilities. And then mobile units are a hugely important piece, working with community leaders, as mentioned, church groups, to get the vaccine out there and overcome any obstacles. And many of those do not require an appointment. I would kind of double down on what was said earlier, that if you have an appointment and you're going to a mobile unit or whatnot, those mobile units are intended for people in the areas they're serving to make sure we're getting those underserved populations. So I would encourage people not to go from far away to, access those. And then 2, if you do have an appointment and go to a mobile unit, please cancel it, because then that opens up a spot for someone else. Thank you so much.
Thank you, Dr. Passarati. Next, I'll turn it over to Dr. Parker from Novant. Thank you.
All right, thank you, Councilwoman Johnson. If you can bring up my first slide. I have can you hear me? Yes. Okay, so I have the distinct pleasure and challenge of going last. And my job's easy because my slides are almost identical to the previous presenter, so I'm not gonna be redundant. I think it's great information. I'm honored to be a part of this. So I stand in the space of working, my life's work in diversity and health equity. I'm a medical director for Novant. I primarily work in women's healthcare. I oversee our women's urgent care centers. I also work in community engagement as a ambassador and working on some of these issues that plague our community. I'm a facilitator teaching about diversity, inclusion, and equity. So I'd be remiss if I didn't start with something that's always very near and dear to us whenever I represent myself as well as Novant, and that's our mission statement that we exist to improve the health of communities one person at a time. And we have our mission and values and vision statement. Our values, certainly diversity, inclusion, and equity, teamwork, personal excellence, courage, and compassion. So next slide, please. We've talked about our challenges in health equity. So certainly health equity is not unique, and it's not been unique to this conversation. We certainly have challenges relative, particularly to the brown and Black community in terms of how we deliver health care. So it's not only equal, but equitable in terms of where the needs are greatest. Deeply embedded in some of that, we've talked about systemic racism, and certainly we all know the challenges of upward mobility and the other social determinants of healthcare that impact everything that we do in delivering healthcare. And so community engagement is ever so important in terms of recognizing those needs. Next slide, please. Next slide. This is just a slide that basically says that we have had representation from Novant on the Vaccine Advisory Committee, as have been the other institutions, Atrium and the health department. But it just shows that we've all been engaged in this fight for equity and how we address the COVID-19. Next slide, please. So I'm going to pause here for a second. Most of my slides are about the vaccine itself, the development, those sorts of things. I'm going to have been well vetted in this conversation. I want to leave plenty of time for questions and answers, so I'm not going to be too redundant. But there are a few things I want to say. And one of those is that it's a very strange dichotomy, if you will, that we're faced with, particularly for our underserved communities, our Black and brown communities. You have voices that, well, I call it a strange dichotomy, double jeopardy, a catch-22, if you will. We have two voices from the Black community. One that's saying, ooh, I have some hesitancy about the safety and efficacy of the vaccine. I have some resistance to taking it and some fear. So we have those voices. We also have from the Black and brown community, we have that thing about equity. Oh, I want to make sure we get our fair share. And so you can see there's a pull and push on both sides of that issue that we have a population that has some fear and hesitancy, as has been reflected by the numbers that we saw. And yet we also have those champions that are saying, don't leave us out. Don't do this just by population density and distribution of the vaccine. Do it by equity, where the need is greatest in some of our communities that we know of. We've already talked about the fact that the brown and Black communities have higher hospitalization rates and higher death rates. And I say this with great pride. My children are physicians, and my one son works in the COVID unit and in the hospital in Presby. And I get feedback from him every day about how real this is in terms of the people that are suffering and dying. I have a daughter that works as a ER trauma physician, ER doctor, and actually she works for Atrium. I think I can say that with great pride. And I have a son that works in primary care. So we all are well vested in understanding the importance and how this is affecting our community. We see it up close and personal. We've stated that in North Carolina, I think you saw some slides that reflected that 16 to 17% of the population in North Carolina has been distributed to African Americans, only 16 to 17%. And so that's the challenge we have. And I mentioned that the distribution should not be based just on population density, but instead on equitable where there's the greatest need. For that reason, we have tried to partner with community and faith-based leaders to basically educate the population. The more information we get, the better. One of the things that Novant has been engaged in, and I've got to give props to our senior medical director, Dr. Eric Esquaglu, who has actually sent a communication to Secretary Cohen asking for more distribution of vaccine. We're utilizing all that we get. And to that end, we're utilizing all that we get. So I think our efforts have been to distribute vaccine in mega events, in churches. We've tried to have weekly meetings with some of our local churches and pastors in our communities. Certainly our Michael Jordan clinics that are in the Crescent area, where there's a higher incidence of some of those social determinants that we're concerned about. The Spectrum Center, large employers we've reached out to for vaccine distribution, the YMCAs, and schools, particularly in marginalized communities and via zip codes that we tried to identify where the need is greatest. In Forsyth County, the Haynes Clinic at the Sears building, Central Piedmont Community College and the Harris campus in the Crescent area. So all these areas we're trying to get to. One of the things that a couple of the things I want to mention is that oftentimes we kind of live in isolation, particularly in some of our Black and brown communities, and not thinking that people are engaged when it comes to the development of the vaccine, the research, the distribution, and all those things. One of the greatest, and I've had the privilege of sitting on several town halls regionally and nationally, and one of the best ones I saw was by Dr. Reed Tuxton of the Black Coalition Against COVID. And that was a town hall, a national town hall that brought together healthcare, research, social, political, and faith-based leaders and organizations. And I think that's important for the Black community and brown community here, that we have iconic leadership and organizations that are involved in vetting this to make sure that it's safe and effective for our community. I think there was a slide that Ms. Gawande presented that showed Dr. Kazmika Corbett. She's a viral immunologist and was key in the development of the vaccines. So this is an African-American woman that was key in the development. And as has been said before, this didn't happen within the last year. There was some 12 to 13 years of the technology being developed. And with Dr. Fauci's group and the Pfizer group, these scientists and doctors were able to develop and isolate that spike protein that you hear so much about. But it was later that in the past year that they, with developing that spike protein, along with Moderna, were able to come together with Moderna developing that use of messenger RNA to package that into a lipid protein that was able to be used as a vaccine. So as Dr. Passerati said, this development of technology has been in the works for 12 years. And it was just that we had the resources, that there was an emergency use authorization, and that it was almost, I would say, divine intervention that we were able to bring all those things together to create an effective vaccine within this past year. I think it's also important to say that, and that slide was shown, that we had Black people that were involved in the clinical trials in the phase 1, 2, and 3 vetting of this, that we didn't miss any steps. We didn't ignore any steps. And I think nearly 9.8 to 10% of the participants in those trials were African Americans. So that's important for the Black community to know that, well, how do they know that this is effective on Black people? Black people weren't involved, brown people weren't involved. Well, yes, they were. And that's not nearly reflective of the overall population of the nation, 13%, but 10% is pretty good. And I wanted to make that point. And last but not least, I want to make the other point that I think that we've had iconic leaders nationally. I always pose the question, who do you trust? And, do you trust, because we've had iconic leaders and people that have really touted the efficacy and safety of the vaccine. So I sometimes ask some people that are reluctant, well, who do you trust for your information? Do you trust Barack Obama? Do you trust Dr. Fauci? Do you trust President Biden? Or do you trust Mark Morial, the president of the Urban League, or Leon McDougall, the president of the National Medical Association? Do you trust people from the faith-based community, Dr. Calvin Butts of the Ascension Baptist Church in New York City? Do you trust Dr. Reed Tuxton, the Black Coalition Against COVID? Do you trust Samuel Jackson, Tyler Perry, Kareem Abdul-Jabbar, Al Roker? And as my pastor would say, well, I don't know if you're hearing me, so come a little closer. So if you don't trust those national figures, do you trust those local people like Harvey Gantt? Do you trust Hugh McCole, John Hatch, Velma Leak, Henry McCall, Pastor Clifford Jones, Dr. Jerome Williams, Dr. Ophelia Garman Brown? So you have to start to ask yourself, if I don't trust those people, who do I trust? Do I trust Sam Jones on the corner? Or do I trust somebody that I ran into in the grocery store? Where are you getting your information? So I think it's important that we have, as was said by Reverend Calvin Butts and Mark Morial, the right message from the right messengers. And so I think we need to do all that we can. Another thing that I'll tell my constituents and people in the community is, you know, we got the Super Bowl coming up. So right now, the score of the ball game is 450,000 to 0. As far as I know, there's 450,000 people that are dead, not because of the vaccine, but because of the virus. And as far as I know, documented, there are 0 people dead from the vaccine. So that's somewhat simple math. One of the other things that was mentioned was I saw some great information today that came out that was the Oxford AstraZeneca study that said that not only might the vaccine prevent illness, but it may also be showing that it prevents transmission. And I think Dr. Pazzarotti mentioned that, but I think there's some great new data that's coming out, and it was on the national news today about the Oxford AstraZeneca study that showed that it might not just prevent illness, but prevent transmission. And I think that's a great thing. I think we have to be exquisitely careful that we don't suffer COVID fatigue. And Dr. Pazzarotti and others mentioned that as we move into the Super Bowl setting, that we can't let our guard down. We're getting there. There is a light at the end of the tunnel. But we can't start to say, I'm so sick and tired of this, I'm just going to go out there. In the Black community and Brown community, oftentimes we rely on our faith, but we have engaged our faith-based leaders that are now saying, you know, don't just pray this away. The prayer is inclusive of doctors, scientists, and healthcare professionals that God uses as tools to get us there. So we've got to rely on that message from our faith-based leaders as well as prayer. And I'll pause there for comments and questions. So thank you for this opportunity.
That was excellent, Dr. Parker. Thank you. Thank you, Dr. Costa. Thank you, Harris. Thank you, Patrick and Commissioner. At this time, I'll ask some questions. Gotten quite a few questions, and what I'd like to do is just ask the question, and whoever wants to jump in to answer it, let's do it that way. Okay? Is that all right with you all? Good. Okay. First question I have is, what percentage of Mecklenburg County residents need to be vaccinated for us to move toward herd immunity?
So that's I'll take a first jab at that. So that's an excellent question. You know, herd immunity in general, we think of 60 to 80% of the population need to be protected. You know, that number varies a little bit, but a large percent of the population needs to be protected to kind of consistently interrupt the spread from one person to another. Now, that protection may come from, natural infection recently, or it may come from vaccination. You know, the only thing I would, and I think this was mentioned kind of earlier on, the problem with some people think, we'll just let everyone get infected and then we're protected and we don't need a vaccine. Why should I take the vaccine? I'll just say, I think it's been well pointed out, natural infection, we've had hundreds and thousands of deaths from natural infection. So getting to herd immunity that way will leave a lot of destruction in its path. And then the other thing I would just kind of caution people, we have seen episodes where individuals who had been naturally infected develop infection a second time. So, vaccines provide a more consistent level of protection and do so without the consequences of hospitalization, death that we see with natural infection. So, it's a lot of the population. We have a long ways to go to get those vaccination levels up and get the community protected.
Thank you. Does anyone want to add anything to that? Okay. Next question I have is, what free transportation options are available for residents who are unable to travel on their own?
I can take a bit of a stab at that one. I'm assuming they're talking about individuals traveling to vaccination sites. We have worked with both the county's MTS system as well as CATS to provide transportation to individuals that are coming for vaccinations. If individuals need help with transportation, they can call that number, 980-314-9400, option 3, and staff will help them get the transportation they need to vaccination sites.
Okay, and that number is listed in our chat.
In the chat, yes it is.
Thank you.
Mm-hmm.
What are the city and county doing to make sure communities of color have equal opportunity at getting vaccinated? So,
yeah, that's I'll take the initial stab, but you know, this is a concerted effort across both the county as well as both of the healthcare systems. We all are recognizing the need to make sure that those who are disproportionately affected by this need to have higher percentages of vaccinations than everyone else. And so we need to work to get the vaccines out into those communities. And that's where Dr. Pazzaretti talked about the mobile units that are happening through Atrium. Novant is also doing that. This weekend they have an event at a site in the community. Our department is doing that as well. We have a site this weekend at the Henry Center. We're also going to do some of the housing authority sites, a number of different things. So we're all working on this together. We actually have a planning group that meets once a week to talk about how we organize this so that we can leverage this vaccine in a way to get to those communities as best we can. So it's an ongoing effort. The thing that holds us back, and this is across the board, is the availability of vaccine. We're getting as much vaccine out as we have available to us, but we do know that there are limits. As Hattie said earlier, the state gets about 120,000 doses a week. That doesn't go very far across North Carolina. So we're doing the best we can. And we'll continue to open those sites up and make it more available as vaccine is more available.
If you don't mind, I'll just jump in and say a few things that we're also doing at the state level to try and make sure that historically marginalized populations have access to the vaccine, because I think that there are a lot of levers that are in our hands at the state and not necessarily at the county or local level. So the first thing and the most important thing is meeting people where they are. So making sure that vaccine sites and providers that are being onboarded have access to and existing relationships with communities of color. So we have a very limited supply of vaccine providers who are currently able to receive vaccine. And right now we are prioritizing additional providers who are federally qualified health centers, which are health centers that are used to providing care to uninsured or underinsured individuals, rural health centers, and community health centers. Number 2 is our provider guidance now recommends reserving appointments for marginalized populations or setting aside appointments for people like community health workers or even churches and pastors to be able to fill those slots with members of their communities. The next thing, and this is new, and I think it's really going to drive some change, is we've changed the way that we allocate vaccine at the state level. So now communities that have census tracts of concentrated poverty or concentrated populations of Black, Latinx, and American Indian populations will get extra doses. And we've made very clear that those are supposed to be targeted specifically at those populations. So those equity bump allocations are going to help get supply to marginalized communities. And then on top of that, you might have heard about community vaccination events, and there have been large ones at stadiums and things like that in the past. Gibby mentioned some of them, but now we're going to be choosing future vaccination events based on whether they're doing intentional outreach and putting in place specific measures to reach out to communities of color. And then the last thing, and just speaking to Commissioner Dunlap's point about data, is we now, as of this week, have data on a county by county basis about how their administration of vaccine breaks down according to race and ethnicity crosstabs. To Commissioner Dunlap's point, unfortunately, the federal program that serves long-term care isn't able to give us their data, but we have lots of data outside of that that's going to be able to drive local operations and basically let them have immediate feedback on how their strategies are affecting the racial breakdown of vaccination.
That's excellent. Thank you for that information. To look at it from an equitable lens. That's so important. Thank you. Okay, once the vaccination is available for all residents, can employers legally require remote employees to get vaccinated before returning to work?
So I am not a lawyer, but I got a presentation from a lawyer earlier today on this subject. So with the caveat that this is not in any way legal advice, I will first say, check with if you're an employer, check with your lawyer. But the gist of what I was told earlier today is that with reasonable exceptions for, religious or disability accommodations, people can require their employees to get vaccinated, but they can't necessarily enforce those requirements. So it is much more difficult to then exclude someone from work because they haven't gotten vaccinated. So I think that from a state perspective, we really care about making sure that everybody has the information that they need to make an informed decision about getting vaccinated for themselves.
Okay. And again, check with your attorneys, right, for that information. Okay. Someone mentioned a decline in the interest in getting tested. What do you think is causing the decline in the interest in getting tested?
Looking at, I think either Gibby or I could jump in here. I think the first thing I will say is I think the pattern of testing really varies across communities. So again, at the state level, we are pushing testing as hard as we ever have. We have our regional testing providers still very active, and we're still seeing a lot of interest in testing. We were posting huge numbers of testing around the holidays, of course, because people were interested in getting tested over the holidays. And so that naturally comes down a little bit. So I'll say whether that's true kind of varies. I think the second thing, though, is, and speaks a little bit to Gibby's point about how we have to be really, really careful about our prevention measures while vaccine is here, is I think everybody's reacting to the news with celebration and realizing that there's a light at the end of the tunnel, and that it will finally be safe to go out and do business as usual eventually. And some people's behavior is already changing now, and people are already feeling a little bit more safe now, even though there's tons of vaccines still in the community. So that might be fueling a little bit of behavior about people who don't feel it's as important to take those prevention measures.
Yeah, I would agree with that. And I would say that, that COVID fatigue that we're experiencing certainly feeds into that. And particularly for people that are young people that seem to kind of feel a little bit more invincible, that they're not in the high risk category. And it also has posed a question for me, and maybe someone else on the panel will want to weigh in on this. And that is, as young people, particularly in the age of 20 to 49, seem to be the population that's spreading it the most, because maybe they have this sense of invincibility and they're out and about a little more. Should we have stratified the distribution and to younger people based on that? If they're the ones that's passing it, not the school-age children and not the elderly that are staying at home, should there have been a national drive or local drive to realign that distribution to younger people who are the ones that seem to be spreading it? And, and by the same token, there's also in terms of the different categories that we have for distribution of the vaccine, you know, we're not exactly doing it by risk tolerance. I'm blessed and over 65 years of age, but in pretty good health. But I know there's 40-year-olds that have multiple medical problems, diabetes and hypertension, that are at the end of the line because they're not old enough. So I'd welcome some comments on the young people and distribution of vaccine based on risk tolerance.
Yeah, let me jump in on that real quick. And I saw Gibby probably has some comments too. I'll just give the state perspective on why we prioritize the way that we did. So Dr. Parker is correct that people nationally ages 20 to 49 are driving about 3/4 of the spread of COVID, but people over 65 in North Carolina are 83% of the deaths. So that's true. I will say first is remember for those in the audience is that the CDC still recommends that you take simple preventative measures after you get the vaccine. And the reason why that is because we think you still may be able to transmit the vaccine after you get vaccinated. And so as a result, what the vaccine is most valuable for right now and what the science underpins is preventing severe illness and that hospitalization and death from COVID-19, which is why we were really targeting it toward that 65 plus population. When we see more data from the trials and the CDC might let up a little bit on that requirement that you wear a mask and take all the preventative steps after you get vaccinated, then that might drive our strategy a little bit. But right now it's best for preventing serious illness and death. And we know those 65 plus are the most vulnerable.
Yeah, let me chime in here just for a minute from a grassroots perspective. You know, once you put something in the community, it's kind of hard to take it back. Mm-hmm. And some of you will recall that when we first heard about the virus, the word was that young people are less likely to get it. And I think there are a lot of young people who still have that fixed in their mind. They're less likely to get it, and therefore they feel like they're immune. And as a result of that, there's still a lot of young people who recklessly go about our community not protecting themselves. And we see that every time we see a video of what's going on in some of these bars and clubs. Is typically that population that you see who are unmasked, not being socially distanced. And so I don't know what we can do to turn that around, but we need to make some kind of concerted effort to do that. And so while I have the mic, I want to also share another thing that I've been thinking about. And I don't know if Gibby said it tonight or not, but she typically reminds our community that this is a federal vaccine program. And while there might be people in our community who want to take the vaccine, what we're finding is that there are lots of people coming into our community from other communities, and we can't stop them because it's a federal program. And that means that anybody in the country essentially could come to Mecklenburg County and get a vaccine, provided that they meet the age requirements at this point.
Yeah, I want to reinforce something that Chair Dunlap said too, is the other thing that we're seeing these days is less response to case investigation and contact tracing. As this particular pandemic has gone on and people have gotten tired of things, they don't want a telephone call from the health department telling them they need to quarantine for 14 days. They're not taking those telephone calls. And quite often that means that they're not recognizing that they may have been exposed and they're not getting tested. So I think that's contributing to some of the drop off that we're seeing in testing as well, is people are just not recognizing the fact that they may have been exposed and are not following through with the test. So I think there are a number of reasons that contribute to that. And that again contributes to the fact that we've got younger people who are asymptomatic or may have minor symptoms and think it's a cold or the flu or virus, you know, some sort of allergy or something, that are continuing to move around our community and not using the prevention measures that we put out there, which continues to keep our numbers as high as they are. So there's any number of things I think that are contributing to the situation in our communities these days. And until we have all the vaccine we need, it's just going to continue to be something that we've got to reinforce over and over and over and over again. I know people are tired of hearing me say it and tired of hearing others say it, but it's the 3 W's and it's staying at home. So we'll just have to continue to say that.
Okay, I've got a lot more questions, but I do want to ask a couple follow-up questions. Hattie, you said that individuals are able to transmit the virus after they've received the vaccine. Do you know the window, or does anyone know the window of time that a person can still transmit the virus after they've been vaccinated?
So let me be clear, and then we should maybe let our MDs weigh in. So the reason why the CDC still recommends that you take prevention measures after you get vaccinated is because while it creates those antibodies to fight off the virus when you're exposed to it, it doesn't necessarily prevent you from transmitting it to somebody who doesn't have the vaccine and isn't as protected. I think, and I'm going to have the MDs jump in here, I think that there will be a point maybe when we have more information from the clinical trials to shed more light on that, but we're just not at that point now, which is why the CDC is being risk avoidant.
Yeah, I would just echo what was just said. We know that the vaccine protects the individual that got vaccinated. We still need to learn. We anticipate that ultimately we will learn, and we've seen glimpses of data that support that vaccination may also help in preventing spread. The AstraZeneca vaccine, as was mentioned earlier, has some data. Israel is starting to put out some data, who has vaccinated a large chunk of their population, that they're seeing protection of the community as well as decreases in transmission. But until we know for sure, with rates in the community as high as they are, we need to err on the side of protection on safety and still wear that mask, still stay socially distant, with the end game of once we get vaccination rates up, once we get community rates down, that those measures start getting kind of peeled away. And the other thing I would say, 95% is amazing as far as protecting the individual. It is not 100%, right? So that means 1 out of 20 people, even if they're vaccinated, can develop COVID. So, for all those reasons, while the vaccine is excellent and protective, A, we're still learning, and B, nothing is 100%. So while we're still in this tenuous place in the pandemic, it's important to still do those protective measures. And, as far as when someone is infectious, typically you're most infectious when those symptoms start, but also in the 48 hours before symptoms start. And that's been part of the trigger all along in this pandemic, is that individuals, before they develop symptoms or, may never develop symptoms, can spread the infection, and why that mask is important for everyone.
Okay.
Yeah, I'd certainly agree with what's been said. I mean, I'm three weeks out from my second dose of the Pfizer vaccine. Felt fine, by the way. Had a sore arm on day one. But I agree. If I let my guard down thinking that because I've been vaccinated and I'm around someone that has COVID and they don't have a mask, or they call for sneeze, that virus can get in my nasopharyngeal area, be stored there. Now, because I've been vaccinated, maybe I don't get sick. I don't have any symptoms, but I'm harboring that vaccine and have the ability, if I go to someone else, one of my older relatives or someone else, and I cough or sneeze or clear my throat, I could expel the virus to them as a transmittable virus, and then they get acquired and get sick. So, I mentioned the Oxford AstraZeneca study, and as Dr. Pazzarotti said, more information to come. That's very hopeful that it will not only prevent serious illness, but will hopefully also prevent transmission. But the word is still out, but there's some encouraging new data that's coming out.
Okay, thank you. It is almost 7:30. I'd ask for just another 5 or 10 minutes from everyone, if that's okay.
I have a call right after this, but I will happily stay another 5 minutes.
Okay, thank you. Okay. Sorry. What's the distribution plan for immigrant seniors 65 and older with language, transportation, and technology barriers? And are you working with grassroots organizations to reach this group?
I can tell you what the health department's doing right now. We're actually working with those folks who serve the immigrant community. We do have an event on Saturday at the Hindu Center. Right now, I think we only have a few appointments left for that center. So we've had good response to that. And I know that there are at least 11 languages that are represented in that group that's going to be vaccinated. That does not mean that there's not more need than that. It's a start, but we'll continue to work with those communities, as I know both of the healthcare systems will as well.
And then that question was from Councilwoman Ajmira. So Councilwoman Ajmira, if you want to reach out to the health department and reach out to Gibby Harris if you know of some organizations that would be willing to help.
That'd be very helpful. Thank you.
Thank you. Someone says, I'm seeing more people wear two face masks at once. Is this something that the medical community recommends?
So some people have definitely been talking about double masks here recently. You know, I think the CDC is starting to study that to see whether there is benefit from it. You know, I think the most important thing for me, or the message I hope people, you know, to me, I'm not sure that wearing multiple masks, if you wear it below your chin or under your nose, is doing much good. You know, the best thing you can do is have a good quality mask. So that means tightly woven, 2 to 3 layers, and fits your face well, and you're wearing it appropriately. You know, my suspicion is that appropriately worn, a good mask is fine, and, you know, 2 masks aren't that much more protective. Having said that, if you wear gaiters, those very thin single layer things, those we know are not as protective. You put a bandana over your mouth, those kind of things just are not as good as filtering out the droplets you're inhaling or what you're putting out into the world. So if you are someone that kind of wears that type of mask, there may be additional benefit to wearing a surgical mask under the bandana, or, you know, doubling up in that instance to try to kind of have multiple layers and achieve that end goal of 2 to 3 layers, kind of keeping you protected from the outside world and the outside world protected from you.
Okay, thank you. Are COVID-19 tests taken at actual healthcare facilities more accurate in detecting the virus than tests administered at rapid testing locations?
So there are different testing platforms out there with different testing characteristics. You know, some that have more false negatives than others, but I would say it's not site specific, it's type of test specific. So what we consider the gold standard is something called a PCR, polymerase chain reaction type test, and it's the best at detecting it, the most sensitive. And then there are rapid tests that use similar technology that are very, very good. And then antigen tests that also give you quick results that are good in symptomatic individuals, but maybe not as good as those other tests. And where, you know, we always tell people to have a word of caution is if you don't have symptoms, you know, none of the tests were designed to be thoroughly used when you don't have symptoms. So always kind of take those with a grain of salt if they're negative. If you had an exposure or something like that, and then you develop symptoms, you need to go get tested again, you know, and make sure that's correct. And then similarly, if you have symptoms and you get a test that's negative, a test may need to get repeated or use a different testing platform, you know, that if you're symptomatic, especially with as much COVID is going on right now, don't just take a negative test and run with it and go to the Super Bowl party or, hang out with a bunch of people. If you're sick, stay home. There are times when we would repeat a test if you're still having symptoms.
Okay, thank you. So there's some questions about making appointments. And what I'd like to do is for Atrium and Novant to give the information about making appointments so we can begin to wrap things up. Because we know there's been challenges in individuals making appointments online. So the question is there a difference in the number of appointments scheduled via phone and online? I'm wondering if there is an accessibility issue for seniors who might not be tech savvy. So if Atrium and Novant can both give some hints and some information about making appointments, that will be great.
I'll start by saying that, and I'll speak for a little bit for Dr. Pazzarotti. If you are in alignment with one of the healthcare systems, then oftentimes you, by way of your age, demographics, and risk factors, will be notified via MyChart of of how to register and when you're available to be tested, and they will send you notification messages as to when and where and how you can sign up to take advantage of that. That being said, and you mentioned that if you're not tech savvy, so I think we have a phone number that certainly you can call for the Novant helpline, as well as our Novant platform to get information on how you can register online. But yeah, the best way is to be able to have someone assist you with getting on that platform or just finding the number via search and calling the Novant helpline.
Okay.
Yeah, and from the Atrium side of things, very similar. There is the My Atrium that if you're already a patient, you can kind of schedule through there if you're tech savvy, but absolutely not everyone's tech savvy, and that is not the only solution. We have a hotline you can call. It's 704-468-8888 to schedule an appointment. I will say, as you have heard, we're all very busily trying to schedule appointments, and there may be a little bit of a wait time, but that certainly is an option. And then, the roving units that have been mentioned, at times can help people. Some of them don't require appointments. You can kind of see if you meet criteria and go there, and those will be, as we work with community partners, spread through those community partners to get to the populations that they're trying to serve. And there are groups trying to overcome, if there are issues with kind of calling or scheduling online, overcoming any barriers so that scheduling isn't the thing that's keeping you from getting vaccinated.
Okay. So if a person wants to schedule an appointment, they should call this number or go online to either one of your hospital sites, and there'll be information and maps to locations on where all these vaccinations are being administered. Okay.
Yeah, both of us have a website that has all that information laid out, and you can and even the state site also can direct you to locations everywhere and kind of plug in. We're trying to, this is certainly a community effort, more than there's ever been a community effort before between healthcare, public health, and everything. So we try to be as redundant as we can be with sharing that information in different areas.
And we'll make sure we share that in the chat. And then Gibby, you mentioned the phone number. People aren't answering the tracing calls. Is there a number that they should look for on their caller ID, or does it come from different phone numbers, or?
It does come from different places now because the state has implemented a system that will send a text message out, and that will come from a state number. But then the health department also has numbers. If people are receiving a number they don't recognize and they're concerned about, they can call our hotline and find out whether they've been contacted or not. So it's a way of double checking to make sure that you're not getting false information from somebody. So if you've gotten a call from what looks like a county number, or you've gotten a text message from the state and you're wondering about whether that has anything to do with an exposure you might have had, you can call our hotline, which is 980-314-9400. It's in the chat. And there's several different options in there. You go to the right option and we'll address that issue with you.
Okay, and what's that number again?
It's 980-314-9400.
Okay, all right, we have that number. Okay.
Thank you.
Thank you. Donata, do we have the slide with the email addresses and contact information? We will share information on our chat. I want to thank everyone for participating. This was a great town hall and question and answer session. And any questions that we did not get to, we will share information with your contacts. Is there anything that anyone wants to say before we wrap up? I truly, truly appreciate this is important information, and it was just an honor having all of you. Thank you.
Thank you for the opportunity.
Thank you.
Yes, thank you. Great.
Thank you. Good night.